8 tips to control type 2 diabetes. You've just been diagnosed with type 2 diabetes. Your doctor prescribes you with medication and places you on a long-term treatment plan. Several months pass, you haven't been taking your medication regularly or made any lifestyle changes, and suddenly you find you're not feeling too great. You feel thirsty all the time, you're eating a lot, your vision is blurred, your energy levels are low, and you find yourself feeling dizzy and lightheaded. And seemingly out of nowhere, you faint and lose consciousness. What you just experienced could be one of many complications of uncontrolled diabetes, such as hypoglycemic event, stroke, heart attack, or diabetes neuropathies. Hello, and welcome to MedTouch, the best place to find the right medical information. Type 2 diabetes is a chronic and progressive medical condition that affects millions of people worldwide. Type 2 diabetes occurs when your blood sugar, also known as glucose, becomes too high, causing a buildup of glucose in your bloodstream. Normally, insulin, a hormone produced by your body, regulates your blood sugar by relaying it to your cells in order to provide you with energy. However, in type 2 diabetes, your body doesn't use insulin correctly, which means that sugar cannot be converted into cells to be used as energy in order to fuel your body. If left unmanaged, type 2 diabetes can result in chronically high levels of glucose in your bloodstream, which can develop into severe, life-threatening health complications such as heart disease, stroke, kidney disease, mental health issues, hypertension, blindness, and even death. Unfortunately, there is no known cure for type 2 diabetes, but by taking proactive steps to effectively manage your symptoms, you can help to prevent and delay these serious side effects. That's why, in today's video, we are going to share 8 effective tips that you can use to manage your type 2 diabetes and keep your blood sugar levels under control. Tip 1. Learn about your condition. If you've recently been diagnosed with type 2 diabetes, the most important step you can take in managing your condition is by educating yourself on what exactly type 2 diabetes is, how it affects your body, and how you can manage your blood sugar levels. Managing your condition can seem overwhelming at first. However, the more educated you are, the less overwhelmed you will be, and the more empowered you will feel to make positive lifestyle changes that will have long-term health benefits. Luckily, by watching this video, you're already taking this first step. Well done! If you need extra assistance, have a chat with your healthcare professional, as they may be able to recommend a self-management training program that can provide you with detailed guidance and lifestyle coaching. Tip 2. Take medication. In addition to lifestyle changes, your doctor may prescribe you with medication. It is important that you take your medication as directed by your doctor, as it can be essential in helping to maintain your body's blood sugar levels. If you stop taking your medication without your doctor's advice, you could risk making your symptoms worse and increase your chances of developing serious side effects. Tip 3. Change your diet. One of the most effective ways to manage your type 2 diabetes is to change your diet. By eating the appropriate foods, you can help to keep your blood sugar levels within the normal range. Your doctor will be able to recommend a meal plan that works best for you, but generally, you should aim to eat a balanced diet that is low in sugar and saturated fat. High-calorie foods that are loaded with carbohydrates, sugar, and fat can cause your blood sugar levels to spike significantly and can also quickly lead to weight gain as your body is unable to burn off the excess energy. Instead, try to incorporate high-fiber, protein-rich foods such as nuts, legumes, fish, and poultry into your diet. Our body converts protein into glucose slowly, so eating protein-rich foods won't cause an instant spike in your blood sugar levels. It's also important that you don't skip meals and eat at regular times throughout the day. By eating regularly, you'll be able to maintain your energy levels throughout the day without causing changes to your blood sugar levels. And in addition to eating healthy foods, it's essential that you drink plenty of water. Water is vital for keeping your body hydrated, and the best part is, it contains no calories, which means that it won't have any effect on your blood sugar levels. So go ahead and grab yourself a big glass of water. Tip 4. Exercise regularly. In order to effectively manage your type 2 diabetes, you should incorporate regular exercise into your everyday routine. Exercise has many benefits for managing diabetes. It can help your body to utilize insulin more effectively, as well as maintain a healthy weight, reduce your stress levels, and lower your blood pressure. Your doctor will be able to recommend the most appropriate types of exercise for you. However, you should try to aim for about 30 minutes of low to medium intensity exercise each day. If you are not a fan of conventional forms of exercise, such as going to the gym, try to incorporate other activities into your day, such as walking, dancing, gardening, or swimming. Before and after you engage in exercise, be sure to monitor your blood sugar levels and, if necessary, fuel your body with the appropriate foods in order to maintain your energy levels. It's also important to remember to stay hydrated before, during, and after you exercise in order to avoid dehydration. Tip 5. Stop smoking. Cigarettes are packed with harmful chemicals that can cause your cells to stop functioning properly, resulting in inflammation throughout your body. In turn, this causes the insulin in your body to be less effective, which makes it harder for you to manage your blood sugar levels. Smoking cigarettes also significantly increases your risk of developing serious side effects, such as heart disease, kidney disease, blindness, and hypertension. Therefore, in order to effectively manage your type 2 diabetes, you need to stop smoking. If you are having difficulty quitting, speak with your healthcare professional. There are many effective ways for you to quit and reduce your cravings. Tip 6. Avoid alcohol. If you have type 2 diabetes, you need to be extra cautious about the amount of alcohol that you consume. When you consume alcohol, your body has to work very hard to remove it from your liver, rather than focusing on regulating your blood sugar. This can cause your blood sugar to constantly rise and fall, making it harder for you to manage your symptoms. Alcohol can also negatively interact with any diabetes medication you may be taking, which can put you at an increased risk of experiencing a medical emergency known as insulin shock. As a general rule, alcohol should be avoided in order to effectively manage your diabetes. However, if you do plan on drinking, be sure to closely monitor your intake in order to avoid putting your health at risk. Tip 7. Pay attention to your health. In addition to your regular diabetes checkups, you should schedule yearly physical exams in order to monitor your overall health. Pay attention to the health of your eyes by having your eyes routinely examined for possible health concerns. In addition, you should be mindful of your oral health. Diabetes may be associated with higher rates of gum infections, so be sure to get regular checkups from a dentist. You should also be aware of any swelling in your feet, as well as any cuts, sores, or blisters that aren't healing, as these may be a sign of underlying issues or diseases. It's also important that you seek help and support from a professional if you find yourself feeling anxious or depressed. Diabetes can increase your risk of mental health conditions, so don't ignore the warning signs and reach out for help when you need it. There are many great support groups available that can assist you with coping with your condition. Tip 8. Reduce stress. Managing diabetes is a lifelong process, and often it can become stressful and overwhelming. However, stress can also have a negative impact on your body's ability to convert glucose into energy. When you're stressed, your body releases adrenaline and cortisol into your bloodstream, which causes your nerve cells to fire and leads to the production of glucose. If you have diabetes, it can be harder for your body to process the rush of glucose in your blood, causing your blood glucose levels to rise. To help reduce your levels of stress, try to identify possible triggers and incorporate a variety of stress management techniques into your daily routine. Some simple and effective techniques include deep breathing exercises, yoga, meditation, and light physical activity. If you need extra support, don't hesitate to reach out to a trained mental health professional or join a support group online to talk to others who may be going through the same issues as you. Remember, you don't have to face any of this alone. So there you have it, 8 tips that you can use to control your type 2 diabetes and maintain a healthier lifestyle. Remember, there is no cure for type 2 diabetes, but by taking care of yourself and effectively managing your symptoms, You can help to delay and prevent the onset of serious health consequences associated with your condition. Thank you for watching. Don't forget to like this video, subscribe, and click that notification bell so we can stay in touch.